Did you have to link to the class on Friday?
Did I do what?
Did you record the class on Friday or no?
Yes. Yeah, did it not come up on YouTube?
It was. I saw
Yeah.
it. It was.
You ever watched it?
It just pops up.
I can email you the link if you didn't see it. Okay.
Subscribe to 1%.
Yeah.
Yeah.
There you go. It's on the recommended.
Okay, so we were talking last week about the rule of nines for burns. And just to review, a whole arm is 9%. The top front part of the arm is 4.5, back part of the arm is 4.5. So each arm is 9%. For the legs, the top part or the front part of the leg is 9%. The back is also 9%. So a whole leg would be 18% of your body. The torso, you can divide that into two halves, 9% each. The whole head is 9%. The front of the head is 4.5%. So you get the idea about that. So the reason why this is important for paramedics to estimate how much water fluid you lost. So to get an idea of how critical your condition is, how many IV bags you need to replenish your fluids, and how fast you get to the hospital to do that. For children and babies, you can see it's a little bit different percent. So it's not exactly the same. They have more weight in their legs. And as children get older, you can see that they have less. I think we already wrote this down last week, didn't we? We wrote down. So check your notes to make sure, but I think we were here last week. So we talked about the two reasons why burns are so dangerous. The first reason is dehydration. You lose fluid along with electrolytes because your fluid contains sodium, potassium, chloride. And electrolytes are important for muscle functioning, for heart functioning, for nerve functioning. So your body can't function without electrolytes. So those are two important things you lose with burns. Infection is also a serious risk, especially if you have really deep burns.
So does it have to be a third degree burn for it to get to the bloodstream, infection wise, or?
No, it can be a second degree where it starts in your dermis, but it can travel down to your bloodstream. Infections can travel. So they can start in one place, but move on further down. So yeah, second degree burns can be serious. I think we already talked about this too. Right, didn't we?
Yeah.
Okay. So first degree burns look like sunburns. They're just red marks in your skin. They just only have the epidermis affected. First, second, and third tell you how many layers are affected. So first degree burns only affect your top layer, your epidermis. Second degree burns go to your dermis, your second layer, and you get blisters. Third degree burn goes down to your fat, muscles, even down to bone. And some also have a fourth degree burn label, which, I mean, it depends on the book, but I think most books now would say there's a fourth degree burn label, which would go down to your muscles and bone.
So if you did get a second degree burn, but you treated it with antibiotics and stuff, that's fine.
Well, you might, if it's a big enough burn, you have to go to the hospital for that too.
All right.
I mean, but how big of a burn are you talking about?
Hey.
They're really painful.
Yeah, it hurts super bad.
But check for an infection. But if there is an infection, you definitely do want to get antibiotics for that. If
No, I already put it on before. Right. Exactly. I might.
How'd you get it?
I burned it at work.
Oh.
Yep. They didn't even care. Pizza. They didn't get me anything. I spilled the whole pizza on myself.
Oh. That could have been. Oh, wow, that sounds bad.
It was so embarrassing too.
Oh.
Everyone's seeing me just covered in sauce.
Oh man.
I'm serious.
Okay, moving on to other disorders. So we're just going through a couple more skin disorders and then we'll stop for this slide. Cellulite is a very common skin disorder. So basically it's lumpy dimpled skin, especially on the thighs and the hips. It really, and you can see down here what happens. So you have the upper layers of the skin, you have fat below, that's the yellow part. And normally fibrous connective tissue is like rubber bands and it keeps the fat in place. But over time, the fat cells you can see get bigger and they bulge upward, and that can cause dimpling. So common areas, again, are the thighs, the hips, the abdomen, but they can be other places too, but that's the main place you're gonna find them. Almost every woman gets cellulite at some point in her life. 9% of women get that. 10% of men get that. And that's to do with mostly just the fat distribution. And also hormones can have an effect on it too. So over time, as you can see, as you get older, the fat cells get bigger and that makes the dermal area have these dimples in it. So they can treat this with surgery. They can cut these bands right here that keep it like that. Once they cut the bands, it goes back to being smooth. So factors that can affect how much cellulite you have or if you have it, your genes, muscle tone. So exercising, working out can help prevent cellulite, but it's not going to be a guarantee against it. You can be very fit, very athletic, and still get cellulite. But it can certainly help. Hormones also have an effect on it. And then gender by far is the biggest factor as whether you're going to have it or not. And then aging, as you get older, your skin gets thinner, and you're more prone to cellulite. And they have other things you can use, like they have different kinds of creams and massage techniques that they do. But that's not very effective at preventing it or keeping it from happening. Really, the best thing you can do would be to have surgery, but it is expensive. It's not covered by insurance. But that's the really only thing you can do to really prevent it or to keep it coming back. Stretch marks. No. Stretch marks are basically just scars. And they start out as red, purple marks. They can look like you've been cut, but it's not. What's happened is that, well, it's tearing below the skin surface. It's tearing in the dermis. So epidermis is your top layer of skin, dermis, second layer of skin. And when your dermis is cut or cracked, you get stretch marks. So it's caused by tear in the dermis during rapid growth. That could be during growth spurt. That could be if you're a bodybuilder and grow muscle really quickly. It could be through pregnancy. You can see right here, this would be on the, it can be on the leg, the back, the stomach. It can really be anywhere in the body. Yes.
I heard that it also is for, like, when you slim down too. Like, if you slim down, you also get stretch
That's
marks.
loose skin.
No, you get stretch marks too, I don't know.
No, they might appear, like they might have been hidden below the fat. And then as you slim down, they might be more visible. That might be what's going on. But I don't know how they would happen if you slim down. I think they'd already have been there to begin with. I'll have to check to make sure, but that doesn't make sense to me as how they would just appear. I think they might just like look like they're appearing, but they already were there to begin with. Because the damage usually is when you're growing, not when you're getting smaller. Weight gain, growing muscle, pregnancy are major causes of stretch marks. Over time, so at first they look red, purple, but as they age, they can look more colorless. So in the beginning stages, when they're like this, they can be treated. But once you get to this stage, you can't do anything for them really. Laser sometimes can help, but not usually when it gets to that stage. So they begin a red purple color. That's where the capillaries come in. So the capillaries, the little blood vessels are moved to the surface of the skin. That's what you see as the red purple marks. But over time, those degrade. But you don't have enough collagen and elastin. So basically what's happening is as you grow, you need to make collagen and elastin protein fibers in your skin. They're not made fast enough to keep your dermis intact. And that's what you see as stretch marks. And so it's going to be a lot softer in those areas. It won't be the same kind of skin texture because you don't have the protein that makes the skin the way it is. Everybody get those down? Okay, so that's it for skin disorders. Let me stop here for now and give you some worksheets to do.